Differentiating SVT from VT is always a big game. So whenever there is atrioventricular dissociation with QRS complex is faster and independent of P wave, there will be VT. When the QRS duration is more than 160 milliseconds, that always suggests VT. 140 to 160 suggests VT if there is RBBB. In right bundle branch block morphology, QRS duration is more than 140 milliseconds, strongly suggests ventricular tachycardia. In right bundle branch morphology criteria of VT, there would be monophasic R in V1, or biphasic QRS, QR pattern, or R more than R prime, rabbit-ear appearance in the lead V1. In V6, R less than S, R to S ratio less than 1. Big Q, big R, dominantly Q in V6 favor VT. Monophasic R, no small q, no S or R prime also favor VT. Right bundle branch block morphology criteria for SVT, triphasic QRS with small r, big S, big R prime, especially if S crosses the baseline in lead V1. RS complex where R wave bigger than S wave is right bundle branch block morphology criteria for SVT. Determining bundle branch type. Right bundle branch block morphology V1 final deflection positive. Left bundle branch block morphology V1 final deflection negative. So in RBBB final deflection is positive, LBBB it is negative. Axis is right superior axis suggestive of ventricular tachycardia. In right bundle branch block, left axis also suggests VT. In left bundle branch block, right axis also suggests VT. LBBB morphology criteria for VT. V1 initial R is more than 30 milliseconds in V1 or V2. Onset of small r to nadir of S more than 60 milliseconds is also a criteria for VT and LBBB. Notch downstroke on QRS complex indicates LBBB morphology criteria for VT. V6 may have small q waves, big Q, big S or big Q, big R morphology. However, in SVT in left bundle branch block morphology, there would be monophasic big R with no Q waves in V6. Brugada algorithm, no precordial lead, has both big R and big S. Onset of R to nadir of S more than 100 milliseconds in any of V1 to V6. AV dissociation and morphology criteria both V1 and V6 will suggest VT on Brugada algorithm. If none of these is positive, it is SVT. In AVR, initial dominant big R, initial small r more than 40 milliseconds, initial small q more than 40 milliseconds, notch downstroke of negative QRS in lead AVR, and voltage changes in last 40 milliseconds of more than or equal to 40 milliseconds. Voltage change in first 40 milliseconds of QRS. Any of above in lead AVR is VT. If none of the above in lead AVR, it is SVT. So this concludes the criteria for ventricular tachycardia.